Hey everyone, Julie here with Birmingham Mom Collective. And today we're talking with a UAB expert all about gynecologic oncology, which is a little bit of a tongue twister, but it's such an important topic. And we're so excited to learn with Dr. Boitano today. How are you, Dr. Boitano?
I'm doing well, Julie. Thanks for having me.
Yeah, thanks for being here with us with such an important topic. So let's get right into it. So tell us about what you do at UAB.
Yeah, so I am a gynecologic oncologist, like you mentioned, which means I've gone through training, including OBGYN training, then specialized training in specifically female cancer things or gynecologic oncology. And I'm on a junior faculty member here. There's 7 of us total. So I do a little bit of operating, some clinic work, and then also do research here at UAB.
Okay, amazing. That is awesome. So just tell us kind of what is a gynecologic oncologist and how it differs from just a general or regular gynecologist.
Yeah, so we primarily focus on female cancer, including uterine, cervix, ovarian, vaginal, vulvar type cancers. So when you go see your regular gynecologist, they're going to do all the things to try and keep you kind of up to date on your screening and do preventative things. Whereas once they're concerned about a potential cancer, precancer, or even just a really complex issue that they're not sure about, a lot of times they'll refer the patient then to us and we'll evaluate them.
Okay, great. So, what are some symptoms that women should be aware of, which might indicate they need to come see you or somebody in your group?
Yeah, so I always tell women, they know their body better than anyone else. And so if something feels different or off than normal, I always recommend going to your primary care physician, whether that's a, regular doctor or an obstetrician and gynecologist, and getting evaluated. Specifically, some of the things that we think about in our field are abnormal bleeding. So if you have regular cycles and all of a sudden you're having way heavier cycles than normal, bleeding in between your cycles that you previously have not had, or bleeding after intercourse, those are things that we worry about. Other things that we care about is new onset, bloating, difficulty eating, feeling full quickly. I will say the caveat, all women get bloated at some point in time. You eat a meal. I always tell women, if you feel like it's something that's occurred over a few days and then persists into a week or two, and it's just not getting better, those are the things that we want, to hear about and just make sure that nothing's going on. But if you feel like something is different than your norm, I always think it's important to get evaluated by a physician. And then frequently, if there's something going on, then they'll send you to our way.
Yeah, great. Yes, we all do get bloated. So, and especially over the holidays. So,
Yes.
it's good to have that caveat of, hey, wait a week and kind of see what happens there. Okay, so how does early detection of gynecological cancers improve treatment outcomes? So, we're talking about early detection and what are some of the most effective screening methods?
Yeah. So our cancers are kind of split a little bit as far as some of our cancers, like cervical cancer. We have a great screening method. So a pap test is what you get, either yearly or every few years with your gynecologist. Really, really important. The whole goal behind a pap test is to try and prevent any sort of type of cervical cancer or even find a precancer where we know we can treat it before it turns into cancer. So from a cervical cancer standpoint, we've got great screening. Even more importantly, we have prevention. So there's actually something called the HPV vaccine. It's offered to any child that's starting at age 9. It actually goes now up to any man or woman up to age 45. Really, really important. This is one of the few cancers where we can actually prevent it. And so getting this vaccine prevents the cancer. So that's one really important thing that I always try to mention. And the goal is to try and do it when your child has not been exposed to HPV previously. And so doing it anywhere between 9 and 12 is really important for both boys and girls. So we've got both screening and prevention for cervical cancer. Ovarian cancer does not have a great screening method, unfortunately, and we know that tends to present at later stages, stage 3. And so that's the one where I tell women, if you feel like persistently bloated, having, nausea, vomiting, not eating as much, that's when, we really want you to go and get evaluated by your physician. The other really important thing in the realm of ovarian cancer is if you have a strong family history of either breast cancer or other types of female cancers, it's always important to let your physician know that because we can do certain genetic testing to try and see if you're at risk for it. Finally, with uterine cancer, same thing. We don't have a lot of prevention or we don't have screening methods for it in particular currently. But if you're having abnormal bleeding or bleeding after you've gone through menopause, it's really important to go be seen by your OBGYN right away.
Yeah, great. Okay. Awesome. Okay. So, what advancements in gynecologic oncology have been made in the recent years and some treatments and outcomes and things like that? And how has UAB become one of the forefront in that?
Yeah, so I feel extremely fortunate to be able to work at UAB because I think we are on the forefront, and I came here as a resident and stayed as a fellow, and then now I'm on faculty. But I've gotten to learn from some of the leaders in the field, and all of my coworkers here are just absolutely phenomenal people who are always pushing the needle in gynecologic oncology. Prevention, treatment, all those things. So some of the really exciting things that we've had come out is that we know that it's not, most people don't just need standard chemotherapy anymore. We have a lot of new advancements in the world of things like immunotherapy, and other special things called antibody drug conjugates. Those are just a bunch of fancy words, but basically what we're able to now do is look at someone's tumor and do special tests on it and see if they're eligible for a very targeted type of therapy, meaning hopefully less toxicity to the patient, less bad side effects, and more effect on the actual tumor itself. So we, not only give kind of the standard of care type of treatments with chemotherapy and those types of things, but we also have clinical trials available for patients. I think there's a lot of, miscommunication about clinical trials, and people frequently think, oh, that's a last ditch effort. We have a lot of clinical trials now that are actually using what we know works really well, but adding something else in to see if we can make it even work better. And so that is one of the benefits of coming here, is that you're going to get the absolute best therapy possible in the United States, with a lot of experts in the field. I think one of the other huge, benefits of being able to work here and also getting to treat my patients here that I'm very grateful for is when you first walk in here, our front desk is happy to see you. They want to get you the care that you need, down to, our nurses, our patient care techs. Everyone here is very passionate about making sure women are getting access to the care they need and getting treated correctly. And so that makes my job as the person who trying to make decisions about surgery or treatment better, because I don't have to worry about those other things. So we have such a great team. But then also there's 7 of us here, so you have all of those years of expertise, that of people who have seen just about every little thing, and so we're able to provide women with the absolute best care possible, because we work together as a team, and I'm very grateful to be a part of that.
Yeah, we certainly are blessed to have UAB here in Birmingham. I mean, what an amazing hospital. And you're right, a great team and the forefront in a lot of what's going on in the medical field. We just really are blessed. So, been up to UAB many a time. So, love it. And so thrilled that we have you guys here. All right. So, last question is, what advice do you have for women regarding maintaining their gynecological health and reducing the risk of cancers?
Yeah, so there are a lot of really good or gynecologists in town, OBGYNs in town. It's so important to keep your yearly visit. So that is the first and foremost thing. No one likes going to the gynecologist and having to do an exam and all of these things. I get that. But it is so important to make sure that you're kind of having that yearly check-in and making sure that if you're having symptoms, you may not think they're super abnormal, but your physician may say, hey, we should check that out. And so that's the first thing, is make sure you follow up with that. Secondly, and I know everyone stresses this, but the importance of eating healthy and having a diet. We know that a lot of our cancers can be associated with obesity, and so trying to do things to decrease that is important. And then finally, smoking. So, really decreasing or trying to quit smoking, that does increase your risk for certain types of female cancers. And making sure you stay up to date on all of your screening methods. I really push heavy for, cervical cancer screening with the pap test and HPV vaccination, but making sure you're getting your mammograms, making sure you're getting your colonoscopies, all of those things are really important to trying to prevent cancer. We know they work at preventing cancer, and so that's our goal.
Yeah, those are amazing tips. Those are great. Thank you so much for giving us those. Well,
Of course.
thank you so much for your time, Dr. Boitano. I've learned so much. I hope everyone out there has also learned. I know they have. If you have any other questions for UAB Medicine, be sure to head over to their website at uabmedicine.org, and we'll see y'all next time. Thanks so much. Bye-bye.
Thanks.